Is the problem in San Francisco in regards to crime and homelessness related to San Francisco being too far left or too far right? Interesting. So let's talk about it. Keith Humphreys is Esther Ting Memorial Professor of Psychiatry and Behavioral Sciences at Stanford, and he wrote an interesting article about it in the San Francisco Chronicle. Keith, welcome.
Hey, very glad to be here. Thanks for having me.
No problem. So you made a very different, unique argument, but it instantly rung true to me. So you said that it's not liberalism, but libertarianism that's the problem in San Francisco. Why?
That's right. So, I mean, what you think of what is left wing, and that would be things like progressive taxation and generous provision of services. San Francisco does those things. It provides healthcare to just about everybody without concern about ability to pay. It provides lots of services to people who don't have housing. And if we didn't do that, the death rate, the drug problem would be much more serious. So that is not our problem. Our problem is that it's a very libertarian town, very individualistic, a place where people come to be free of social constraints. That works very well for some issues. Free speech, it worked very well. The LGBT rights, it worked very well. But it doesn't work very well for addiction. The idea that if we just back off and let people pursue their freedom, good things will happen. Unfortunately, that doesn't happen in addiction because it really limits human capacity to make good decisions that are good for ourselves and good for other people too.
Okay, yeah, when I read your piece and I was like, oh yeah, Castro District, psychedelic drugs, Silicon Valley's obsessed with libertarianism. I was like, oh yeah, that is San Francisco's history. But now when we talk about people who are addicted to drugs that are on the street in San Francisco, for example. Well, then do you think that the folks that are saying, no, you can't, you gotta leave them there, the state can't force them into addiction, et cetera. But those aren't really right-wingers, aren't they? So I wonder if the left-wing activists don't realize they're being libertarian. You see what I'm saying?
Yeah. Yeah, no, I do. And the thing is, there's left and there's right, and then there's views about liberty and community. And you can be a right wing and libertarian or left wing and libertarian. And there's certainly left wing places in this country that have a very kind of more paternalistic view about community order and things like that. I think you would see those as you go further east in the United States. I do think some of the folks arguing about drugs don't appreciate how close some of their rhetoric is very similar to gun rhetoric. People like it, they want to have it, it's their individual freedom. If other people are harmed, well, that's not their problem. Or rhetoric around vaccine refusal. I don't want to do it, it doesn't matter what happens to other people, I get complete autonomy in my body. Those kinds of arguments are very similar to how people who I think would think of themselves as left-wing sometimes argue about fentanyl use in San Francisco. And I do wish they would think that through a little more fully, because it's not really a public health view anymore. Then it turns into a kind of individual rights over the well-being of anybody else. And that to me is a destructive point of view.
Yeah, there's this old argument about how the spectrum isn't a line, it's a circle. And so as I saw left-wing activists in LA, San Francisco, wherever they might be, Portland, Seattle, saying, no, we can't ever say that the government should force people into recovery or help them with their addiction, et cetera. I thought, have they gone all the way around the bend and become right-wingers? Because that is not really a traditional left-wing opinion, right? Or ideology. And so,
yeah,
go ahead. Sorry.
I'm going to say you're absolutely right. I mean, it isn't traditional, and I think you named the right cities. It really is something that happened in the American West, where people have come for a long time to get free of constraints. And I think politics out here is a bit different for that reason. And one thing I ask, I volunteer at an agency up in the city, and I see people in very serious situations as I walk through those neighborhoods. And one thing I've asked people who believe this is, if somebody were lying on the ground dying of a fentanyl overdose, and I administered naloxone, the rescue drug, I would do it without their consent. I said, would you object to that? And they said, well, God, no, you're saving a life. I'm like, that's right. sometimes when someone can't take care of themselves, we intervene because we care about them. But they don't seem willing to take that same view when it's, say, somebody who's conscious, but they're standing in the middle of an intersection yelling because they're high on a drug and they're, yelling at traffic, or maybe they're not completely dressed on a cold and wintry day. And then they become very libertarian when I say, well, what if we went out there and got that person, even though they don't want to be taken to a safe, warm place? We did it anyway. Then they sort of reverse back to a libertarian view of no, they're being who they are, and you're not allowed to impose on them in any way.
So for the uninitiated, they oftentimes can't believe that activists actually say that, but they do make the case. No, they should be able to go to the bathroom in public. They should be able, close, not close, etc. The yelling, that's be going into traffic, all that is under their rubric of freedom. I mean, that sounds crazy, but they actually do think that, right?
Yeah, there are people who think all the things you just said, and it's not a conception of freedom that I personally share, because I think a certain amount of our freedom comes from constraint on individual rights. So just like we say, you can't carry around automatic weapons everywhere you go and settle your fights that way. That's a constraint on your freedom. But without that, we can't have any community safety. And you can go too far for sure. We don't want to constrain people's right to speech or their right to marry who they want to or be who they are. But at some level, when it becomes extremely harmful to others, normally, we would step in and say, this is not okay. You can't keep doing this anymore. We can't have, kids terrified to walk to school through the neighborhood. We can't have older people in the neighborhood who I know who are afraid to go out past 6 o'clock at night. We can't have shootings on the street as different dealers, slug it out for territory. All those kinds of things that, to me, part of a conception of freedom in the community is we constrain those things, restrict that kind of freedom in order for all of us to share safety so we can all, live the lives that we want to live.
No, as I see those activists and they call themselves left wing, I'm always shocked by it. You don't, and sometimes they'll even say it. Oh, who cares about the community, right? I'm like, what? The whole point of the left is community. And yes, you're supposed to care about the working class mom who's trying to take her kid to school and get to work safely. She's got to work 2 jobs and you're being constant. What do you mean you don't care? That's insanity to say you don't care. But okay, so of course, a lot of people don't say that they don't care. They have other ways of phrasing it, et cetera. To be fair to them, they're not here. But now let's talk about the alternative, because they would say, I think, well, I mean, what are you going to do? You're going to stuff them into some terrible addiction recovery thing that, and not allow them to get out? What kind of government tyranny is this? I know, man, they sound like right wingers. But anyway, what is the solution, Professor Humphreys? What could we do?
So there's a lot of things we can do, because we can look at other cities that have less severe drug problems than San Francisco. There are very good strategies where health people and law enforcement work together to close down open air drug markets, which we have quite significant one in San Francisco. This is what's done in Europe. This is what's done in Portugal, which is often cited as an example of what drug policy should be like. Not to eliminate drug use. There will always be drug use and there will always be drug dealing, but you don't need to have destruction of neighborhoods, inability for families to safely raise their kids, or people just to hang out in the park if they want to. That's something we can all work on together. Second, with people who use a drug and then threaten public safety in some way. They mug people, they break into houses, they rip off catalytic converters, all those kinds of things. We can use the power of the court to say, we don't want to put you in jail for this, but you did commit a crime. We think your addiction is part of it. If you will accept treatment, we will monitor that closely. You will not have to go to jail. And that is putting pressure on them. And people may seem that's unfair, but of course they're putting pressure on others by stealing and robbing and threatening and those kinds of things. And we all have rights. But we also have some responsibilities to each other. And I think that's a case where we should use the power of the state and to guide people into a state of recovery. And one of the things that's interesting to me, I know many people in recovery. Obviously, I work as an addiction researcher, and many of them say they're grateful to the people who really nagged them to change their behavior. Maybe at the time they were furious at their spouse or their boss or the cops, but later, once they get a clear head and are well on in a sober life, they realize, wow, those people really saved my life.
I mean, look, I want to scream, of course. And when you're high on fentanyl, you're not helping that guy by saying, oh, have more freedom. No, that doesn't help him at all. It does the opposite. But now when you're enforcing it, there's also the idea that, well, okay, if you're gonna use the cops to get them to a place they don't want to be, that means you have to crack their skulls. Does it mean that? Or have some countries, Portugal or otherwise, found a way to do it in a humane way?
Yeah, so I mean, as I said, you want to have law enforcement and health work together. So when, for example, Amsterdam closed down their open air drug scene, they first off, they told everybody it was coming. Anyone who can voluntarily escape this situation, please do. And then they had the police arrest dealers, not users, and they had the health services arrive for the users and said, look, your dealer's gone now, but we're here for you. We've got methadone maintenance right out of this van we can operate. We have low threshold services. We will help you. This takes coordination. It takes trust between law enforcement and health, which is at a very low ebb in San Francisco at the moment, but it is certainly possible to do that. And it can be done in a compassionate way. You can use, the power, like the power of the court can be used to harm people. There's no question. We can all see examples of that. But there's also, judges who are very, very good at using the power of the court therapeutically. And we've seen that for years in drug courts, also in other types of courts that focus on people who have serious mental illness. We have a conservator system where sometimes people in the acute phase of their psychotic disorder don't want to have take medication, but they have to. And then, of course, once they're back in their right mind, they realize it's good to be on medication. It's certainly not good to be, tortured by psychotic ideas and feelings and actions, or to live on the street. So that's where we need to go. We need to tend to rights, but also build partnerships between the police and health, and take on this problem in a realistic way and not in an ideological way, which is unfortunately mostly what we've done in San Francisco.
So, Professor Humphreys, one last thing then. So we don't want to stuff the people with addiction issues into prisons. I understand what you're saying about the threat of prison to get them to the right program. I agree with that, and plus they did actually steal and commit those crimes, and so that's an issue. But do we have enough healthcare facilities to take care of those people? Is that funded adequately enough, et cetera?
Yeah, and so that's a really good question. That's one of the things that is at times a bit frustrating about San Francisco. Although we have a large amount of money, sometimes not enough of it is allocated to treatment and recovery-oriented services. So with this ideology that we're talking about, there often comes a lack of either faith that people can recover, or just the idea that trying to help people recover is an imposition, and that wouldn't be appropriate. Who are we to judge, people who are addicted to fentanyl? And so I think a better allocation of services so that we were sure there were enough places for people who want to get out of this dreadful situation rather than just being maintained in it. That's something I think the city could definitely work on. And I can say, by the way, I think there are multiple people on the board of supervisors in the city and in the mayor's office who do appreciate this, but you have to move the city and the bureaucracy along with you, and that's certainly a challenge.
Yeah, the Portugal model and the Amsterdam model, I think, are excellent ideas. And no one thinks Amsterdam, bunch of right-wingers.
Right, absolutely.
Right, and so it is a difficult problem, but I think that you've come up with very good solutions. Professor Keith Humphreys from Stanford, thank you so much for joining us. Really appreciate it.
Thank you, really enjoyed the chat.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.